Welcome to Ready to Talk, Ready to Listen, a podcast about all things mental health. CHE Behavioral Health Services interviews guests as they discuss relevant mental health topics and speak with our industry's top leading trailblazers. Let's get started discussing behavioral health and ways to support our mental well-being.
Hi, I'm Dr. Larkin-Hoyt here.
And I'm Dr. Jennifer Birdsall, and we are co-hosts of the Ready to Talk, Ready to Listen podcast.
We feature top experts and leaders and those interested in behavioral health care and mental well-being.
And we have Dr. Jeremy Weiss here of Rise 25, who has done thousands of interviews with successful entrepreneurs and leaders. But we flipped the script today, and he's going to be interviewing us. So I'll pass it on to Jeremy.
Dr. Hoyt, Dr. Birdsall, thank you for having me. And this is an exciting topic. I mean, everyone needs this in this day and age, which is the state of mental health. And you're going to be sharing some of your expertise with us. Before we dig into it, this episode is brought to you by CHE Behavioral Health Services. And I know CHE offers a comprehensive mental health care solutions, including in-person and telehealth psychology and psychiatry services. And listen, what we're experiencing today, Americans are experiencing greater stress, anxiety, and depression than ever before, all right? If you haven't experienced, you're living in a cave somewhere, because all of us have, right? CHE's mission is to actually provide access to care and support individuals to improve their quality of life and emotional well-being. And I know you have a huge staff there, over 850 professionals committed to providing the gold standard and evidence-based behavioral health care. So to learn more about CHE, you can book an appointment. You can call them 888-831-2618 or visit cheservices.com. And before we dig into the state of mental health here, I want to talk about your backgrounds a little bit. Dr. Hoyt, tell people about your background.
Oh, sure. So I am a licensed clinical psychologist, and I have served in clinical leadership roles for over 15 plus years, specializing specifically in addiction and mood disorders. I divide my time not just as a mom, but as a current clinical director of outpatient services for CHE. I provide clinical consultation to psychologists and therapists alike, as well as used to, prior to the pandemic, I taught graduate school and had led expert national presentations in addiction and suicide prevention.
That's amazing.
Trying to make it short.
I don't want to go after her, Jamie. You should have done me first, honestly.
So, Dr. Birdsall, tell people a little about your background.
I'm Dr. Hoyt's assistant. No, just kidding. Actually,
Stop.
Yeah. So I am also a clinical psychologist. You know, that has been a passion of mine. Literally, I decided I wanted to be a psychologist after my AP psychology course in high school. And I declared my psychology major right when I went to college and went straight through to become a clinical psychologist. And it's been my passion ever since. So like Dr. Hoyt, I find myself now in a clinical leadership position, but my training early on was in health psychology, neuropsychology, also have a specialty working with older adults, but have worked in various populations and settings, from inpatient psychiatry to outpatient clinics to home-based care, rehab, and outpatient as well. So I'm really excited to be a part of CHE, where I've been for 10 years at this organization, because we really are, a top expert in a multi-site, multi-specialty group, just really championing mental health services. So super proud of what we do, and I get to kind of live my passion every day.
You did fine. What are you talking about? That was fantastic. You were way more personal. I was more stat driven. So I'll need to lighten up.
So the state of mental health in America, it's crazy times. There's always crazy times. So Dr. Hoyt, talk about that.
When Dr. Birdsall and I were thinking about right before this podcast, like what should we talk about? There's so many different things to talk about in mental health. And we both just kept coming back to the state of mental health in America, because people right now throughout the country are, experiencing extremely high levels of stress and anxiety than ever before. I know that, not to just, spew a bunch of stats to the people who are listening, but I do think it's really important. So I am going to spew some stats at us because it really just does allow us to kind of think about the magnitude of how many people are impacted by mental health. And so when thinking about stats, I was looking at the CDC, Center for Disease and Control, and they do really, annual stats, and is a reputable site to look at, impact numbers. And what I found from there, what I drew from that was that 11.3% right now, and this was actually 2020, I'll give it 2020, of adults aged 18 or over experienced regular feelings of worry, nervousness, anxiety. So 11.3%. So in my head, I'm like, I think the population of America is about 330 million right now. So that's 33 million people. So when you think 11%, you're like, oh, that's not a big deal. But then when you translate that into actual people and their lives being impacted, that's 33 million people in our country.
And Larkin, when you think about it,
yeah,
every 10 people, one of them is significantly impacted, right? When you think about your family and your friends, or just you're at a movie theater, and however many people are in that audience, how many of them, right, just statistically are really struggling with difficult emotions. So, I think it's a really high number.
Yeah, I like that you actually gave some context to it, because that's a great way to really visualize how close it is and how much it's prevalent in our communities, And then, when I was looking at depression, so that was just anxiety, I looked at depression, and this is actual regular consistent feelings of depression. And that was 4.5%. So that, again, when I break down, do the math, that's 12 million people. And so then you take depression and anxiety, and then I started looking, because, I'm an expert in suicide prevention, I started looking at, loss of life as it relates to death by suicide. And it's, 100,000 per 100,000 population is 14. So another way of saying that, 10th leading cause of death, preventable cause of death. And in 20, and I'll add this too. And when you slice the 10th leading cause of death, it's actually the 7th leading preventable cause of death in males. So, there's no denying that mental health needs to be at the forefront of the minds of thought leaders in our community, physicians, clinicians, family members. It just needs to be something that we regularly talk about.
Yeah. And one thing I'd like to add is, Larkin is talking about these clinically significant issues, but it doesn't have to be clinically significant to impact someone. And so when we think about the state of mental health in America, and we think about, the pandemic and wars and, all sorts of stressors that have been happening in all different
inflation, sorry.
Yeah, financial
gas
strain,
prices.
Just kind of all of the racial stressors that have been coming apart and so needed to, right? But also just kind of the emotions that come from everything that's been happening in America, right? So when you think about that, if you add in the numbers of people who don't have clinically significant levels, but just impactful levels of stress, anxiety, fear, grief, it gets much higher. And to your point, Jeremy, said that if you haven't experienced when you started this episode, some type of increased emotional difficulty, or maybe not you, but if you don't know someone close to you, a family member, a friend, a colleague who has, you've been living under a rock, right? It's just almost impossible to not have someone that you yourself or you deeply care about then, experiencing those difficulties because of financial strain, parenting your children at home while you're trying to work, the fear of the pandemic, loss of socialization, people lost their jobs, so just all sorts of stuff. And, I think the really silver lining is, because we've all experienced this kind of, mental health pandemic on top of superimposed on the pandemic, is it's really increase in awareness for mental health and a prioritization to take care of your mental health. And I know at CG, we really want to see the day where people think about their mental health like their primary care and their physical health, right? And there isn't that stigma to go to a mental health professional or take care of your mental health just like you'd go to take care of any physical ailment. And that would be an amazing world to live in.
Yeah, and to dovetail off that, I mean, I think what needs to really happen where we can see the behavioral change, being psychologist and behaviorist myself, the actual behavioral change is when we know we've arrived at that destination. It will be no different when someone's asking you about your mood, asking if you're feeling suicidal, asking if you're misusing substances, as commonly as when you walk into a general practitioner, your doctor's office, and the nurse starts giving you their vitals to you.
Asking
You
your
know,
blood,
it's just
finding out your blood pressure.
Yep, mental health vitals. That's what they need to
Psychological
be.
vitals.
That's right. That's right,
We
Jen.
should get a t-shirt for everyone.
Yes.
We hear a lot about mental health stigma, right? And
Mhm.
if I were to say, oh, yeah, I'm kind of feeling depressed, that would hold some weight and I may get stigmatized around that. And so people may not feel comfortable saying certain things, right? Because they'll be labeled. And so what's a stigma? And do you have any thoughts about how to reduce mental health stigma?
Oh my goodness, Larkin, I'm going to give it to you. Larkin, I feel like she took the lead on the last one, but this is a passion of hers. And she's so, not everyone's watching. Some people are listening, so they can't see me, but she like literally lifts her hands. She's like, we got a stigma bust. And it's just so physical. And it's just like, we got a stigma bust, mental health stigma, and it just gets you like, yeah, we do. So I got to pass it to her to take the lead on this one.
Thanks, Jen. It definitely fires me up for sure. I mean, we could just have a podcast on, stigma, and I'd love to be able to interview everyday people that have experienced it, walk in their shoes and tell us what it's like. But stigma really is like breaking it down to basics. It's when someone views a person in a negative way because they have a particular illness. And so when we think about it in context of mental health, eliminating mental health stigma is super important, because with it right now, it's a very common reason why people don't receive treatment, right? They don't go because they're fearful of not only what it will do for them socially, but also how it could possibly impact their job or, their well-being. And so there's all these reasons why people kind of stack it upon themselves to say, you know what, I'm too scared to go see a therapist or talk about my mental health because I'm afraid of being judged for it. And the sad part is I want to be able to validate their fear because it still is very present. I think in the last 5 years, we've made leaps and bounds with people who, celebrities talking about it and endorsing prevention and treatment. And, I think different generations like the millennials have done just a fantastic job in really vocalizing it through social media. And so we have made leaps and bounds, but it's still very much as alive in our communities, and it prevents folks. And when I was looking this up, I went to as far as looking at the U.S. Surgeon General, and he actually had stated that stigma is, a public health issue at this point, because people with it, with the mental illness, avoid living, socializing, working with people who have deemed a mental illness. People are afraid to rent to them. They employ people with it. So we have to, as Dr. Berth will say, and I'll get my fists up, we have to stigma bust, right? We have to be the ones, like at CHE, I always say, when we're working with our psychologists, we have to be the ones to carry that, to hold that torch so people can follow us to say, you know what, we're not going to be scared of holding CHE in this quiet little tucked in office that, is down in the basement of a medical facility. We want to be loud and proud. This is CHE. We want to be next to Whole Foods and Ralph's and Vons and you name it. We've got to be out there, because if the professionals are kind of hunkering down like, oh, shh, I'm over here, come on in, then we're never going to get past that to help really bring mental health to the forefront. And like I said, stigma bust. So, one other thing I wanted to add to that I think is a plug, especially being an expert in substance use disorders. I used to always tell my students this, and it always knocked them. And it still knocks me when I say it out loud, is according to WHO, right? The World Health Organization, substance use disorders is the #1 most stigmatized disorder or disease in the world. #1. cardiovascular, cancer, all of it, you name it. Nope. Addiction, substance use disorders, number one biggest stigma disease in the world. So we got to get to work. We got a lot of things to do. And I think that at CHE, I'm sorry to be long-winded, but I am passionate. We're super optimistic that together, coupled with promoting greater awareness of the impact of stigma and how that has had on people who are in need of treatment, we can get to a place where all Americans recognize that caring for our mental health is not only acceptable, but it's freaking good for us. And so that's really something I love about CHE, and I love the clinicians that we work alongside and Dr. Birdsall herself, because we're all a part of, we really hold the importance of stigma busting, I think, near and dear to our hearts.
And I think, after saying that, a lot of people may be interested in seeking therapy, right? You go, okay, I fit into these categories for sure, but they may be unsure if therapy is for them. And so I'd love you to share some insights into what is therapy if someone's never experienced before. Like, there is a stigma, it's held them away so long, and they haven't, sought it out or didn't do it. Tell people about it.
Such a great question. I'm so glad you asked that, Jeremy, because, certainly coming off stigma, that's an important question, because that's often one big barrier for folks seeking therapy. But I think the other part of it is just the unknown, right? What is it? What is it going to be like? Are they going to be analyzing everything I say? And, how can I open up to a stranger? Like, there's just all these kind of, right, questions that go through that maybe prevent people from taking that final leap. So, I'd love to take a moment to just normalize it and kind of walk through what that looks like. And, certainly I will start by saying that, when you work with a therapist, and there's all different types of therapists, or this is an advanced degree where they're trained. These are individuals who are passionate about that work. They have a calling. So they're naturally warm, empathic people that just genuinely feel good to help others. And when, you're a therapist, I think both you have a natural inclination to do this, but it's also part of your training. You don't judge. Like, it's a safe place, right? So we're not judging anything you say, anything you do. We know that's why you're coming. And to really be effective, we want people to feel safe and to trust in us, to share some of the things you think and feel that you wouldn't never thought you'd say out loud, right? Or share or tell somebody else. And that's really important. And that's kind of the goal. It's a very safe place. And so when we think about therapy, it's really for a range of individuals too, right? It's appropriate for people, as Larkin was saying earlier, who have a clinically significant, a diagnosable condition, but even people who are just maybe struggling more mildly with self-esteem issues or goal achievement or all sorts of things. And we're here for you. And, when you meet with someone new and talk therapy, it can be a little nerve-wracking, but it's a relationship, and you're going to build that, and it's going to get easier over time. So that first session, that first interaction can be a little nerve-wracking. You don't know what to expect. It's a little bit more clinical sometimes at first session. I think most therapists still try to build that rapport, make people feel comfortable, and they all have ways to do it. But they have to ask a lot of questions, right? We need to know, why are you here? What's the reason for you coming? What do you hope to get out of it? What are your symptoms? What are you feeling? What are your concerns? What's problematic for you? So we can understand what has brought you there. We can understand, kind of start to develop that treatment goals, right? And treatment intervention plan that's unique for you. Everyone's different. So there's no one prescribed way. Talk therapy is really finding what works for that individual. And you get to know each other. And I think it's just really important to know that therapists are people too, right? We're just humans, and we're not really scary. People have different approaches, but many of us are quirky and real. I know a lot of times I have to tell my clients, like, just be you. I'll notice if it's a younger client, they're, maybe they were going to use a slang phrase, and they're like, oh, well, and I'm, you can use slang. I know slang. You can use slang,
Right.
You can curse if you need a curse. Like, say what you have to say. If I don't know, I'll ask you, what does that mean? So it's like, I'm not analyzing you. You don't have to act professional. Like, we can be real together. And so I think it's really not as scary as people think. And, you build that just relationship and your team together over time. And, each session, it gets easier, and you just learn more about each other, and the therapist really gets to know you. So it's really, it is a safe place. And even if it's a little bit nervous, that's okay. Like, it's a therapist's goal to help make you not feel nervous. But if you do make that leap, I think people will find they enjoy it. And the last thing I'll say there is, with all that said, you may not dig your therapist, the first therapist you try, because they're humans too, right? And so different therapists have different training. Some are more professional, some are super laid back. Like they're just, everyone's a little different. So, it's okay to try to think, well, what would be the right style for me? What am I looking for? A lot, like at CHE, you can pick certain characteristics. If you already know there's certain things that are important to you about the therapist that will help you maybe feel a little safer and connect a little bit easier and build that trust. But if you find yourself in a situation where it's just you're not connecting, it's not going the way you thought, don't give up on therapy. It's okay to find a new therapist. And it's even okay to tell your current therapist, I think I need to go in another direction. We understand that, we really do. And our ultimate goal is we want people to stick to it and feel better and achieve, better mental well-being, even if that's with someone else. So I think that's kind of, the broad basics without going into all of it. But Larkin, I don't know if you have anything you want to add.
I was just going to say, I always say this to even my friends, therapists are like shoes. Sometimes you just need to find one that fits. And when the shoe's slightly tight, like, it's okay, take your shoe off, right? Just, you can tell, like you said, I just echo what you said, really.
Yeah.
You don't be afraid to talk to a therapist. And tell them like, hey, I don't know if I'm really like jiving with you. And we're trained for that. We're trained to hear those types of things. It's not going to hurt our feelings,
Right.
because ultimately what we are committed to, why we went into the training in the first place, is, we want you to suffer less. We want you to experience, enrichment in your life. And if you've got to do that and get into the trenches with someone, the psychological trenches of your brain, so to speak, to really kind of figure out what's happening for you, you got to do that with someone you trust and like. And so I'll just say my last piece is like, and not to sound at risk of, I'm going to sound this way. I'm going to sound a little hippy dippy, but there is a really renowned, wonderful, and Dr. Birdsall will know once I say his name, psychiatrist that has given so much knowledge to the field, Dr. Irvin Yalom. And in many of his books, and in one of his passages, he wrote to a patient, and I've used this so many times, and it wasn't a patient. He didn't use the word patient, and he didn't use the word client. He said, "Welcome, my fellow travelers." And that's really what it's about. When you go into an office and you're working with a psychologist, in office or telehealth, right? Assuming either or, tomato. That really is what the feeling is. Welcome, my fellow traveler. There's not a hierarchy here. This is, let's dig in together and let's figure out what's happening for you and what we can do to change. Absolutely.
Yeah, it's a journey for sure. And I just will say it's not easy.
No.
I don't want to Pollyanna the therapy experience. Right. If you're going, there's something that's hurting you in some way, it's emotionally hurting you. There's something that, you want to work on, you want to change, and that work can be hard.
You're right. It's just, it takes courage.
Yeah, I read courage, and it's worth that. It's
right.
worth that. The hard things always are.
I was going to say, it was a Maya Angelou quote that it was, courage is the most important. Wait, let me see if I don't screw this up. Courage is the most important of virtues, because without it, you can't practice anything. And so I just remembered that. And I think that that's so applicable to when you're thinking about therapy, it does take some courage to do that.
When you talk about it, humans, we worry about what other people think by nature. And so I love what you said, Dr. Birdsall, about having a safe place and no judgment, because, we already are feeling, struggling. Right. So that helps. And so to talk a little about the types of treatments, right? The type of services. So what types of treatment services and what mental health conditions does CHE actually treat?
Yeah. All of the conditions, I'll talk about that. And, really our expertise is behavioral health. So we do what is considered traditional talk therapy. Again, as Larkin said, whether that's in person or via telehealth, and they're equally effective. Some people have preferences for one or the other. With, all, as I said, really compassionate, licensed mental health therapist, and whether that's, a licensed clinical social worker, a licensed marriage and family therapist, psychologist, so that's one of the services. And then we also provide the medication management side, so psychiatry services. And they're different, and some people may or may not know the difference. When we think about the med management, that's if someone wants to get assessed to determine if they can benefit from a psychotropic medication meaning something for mood or psychological disorder, depression, anxiety, those kind of things. And then the talk therapy is the traditional talk therapy. And a lot of times, people want to do both because research has found if the need is there, that really having both can be effective. Some people want to do just one or the other. And some people, again, for talk therapy, just want to focus on a non-medication approach. Some people don't need medication. So we do both. It's really an individualized approach. And then in terms of the conditions we treat, it's really any mental health condition where, at least for our practice right now, it's appropriate in an outpatient capacity, right? So that person is safe and it's an appropriate level of care to get treatment while they're living at home, going to work, living in the community, right? And can kind of do this. So for talk therapy, it's often 1 or 2 times a week. And for medication management, you're often seeing that person once a month just to make sure the medications are working. So that's kind of traditional. And, sometimes the conditions is a diagnosis, right? We give someone a diagnosis: major depressive disorder, bipolar disorder, generalized anxiety disorder, post-traumatic stress disorder. So it can be that and other various diagnoses. But again, it doesn't need to necessarily meet that level. So some people, it's just more of an adjustment issue, right? They're struggling with their mood, whether it's kind of feeling down or anxious because of just hard things in their life, right? So if it's stress at work, stress at school, relationship stress, right, with their partner or someone else in their family, difficulty with parenting, grief reactions, all of those things. And so it really runs the gamut. So if someone is, wanting to work on their mental well-being, if they're struggling in some way emotionally, if they're having symptoms that they're saying, I'm doing my best, but I think I can use someone else to help me cope. My regular coping mechanisms just don't feel to cut it. I want to get better. I want to get better faster. I want to dig into working with someone. Then we're here to help them.
There's a lot of behavioral health organizations that specialize in various things. So talk about CHE and, what makes CHE different.
I think I can get this one, because I get fired up about it. You're right. You're right, Jeremy. There's tons of different types of services. Mental health has expanded, and people, want to invest into this type of opportunity because there's a need. There's such a large need for it, right? So there's in one vein, that's really exciting for behavioral health. In another, you have to then differentiate, which place do I go to get services? And what I like about CHE that makes us, I think, really different and unique from other behavioral health organizations that are starting to kind of sprout up is that at the core of what we do, 25 years plus, we've been doing it too, is we're a multi-specialty medical clinic-based group of licensed mental health professionals, psychiatrists, psychologists, licensed marriage family therapists, licensed clinical social workers. We run, as Dr. Birdsall said, we treat it all. We don't exclude anyone, right? As long as it's appropriate for this particular level of care. With that said, at the core of us is that medical clinical based thought process, right? We know we're experts in what we do that happen to provide technology as a way in which we can communicate and provide access to more people. Whereas other newer behavioral health organizations, kind of the Silicon Valley, if you will, startups, is that they're a little bit opposite. You flip the script, right? They are at the core of them, they are technology based that happen to provide mental health services. And see, there's a unique, I'm being specific with my semantics because, again, let me just say that different. Let's say it again. At CHE, we're a multi-medical specialty clinical group that happen to provide technology. So we do that best. And we use technology as a way to create more access points for people in our community and our nation at large to get the help that they need. And I think that is one of the biggest discernments between us and the rest of our competitors, to be honest.
Before we end, I get stressed hearing all the stress in the world and everything we're talking about.
Traumatizing.
Can you share some quick tips for stress management? How to improve our mental well-being?
I love that. Larkin, do you care if I take some?
I think this is all you, Dr.
Okay.
Birdsall.
Also, I do want to say your nails look awesome.
Oh, thank you.
I was
Larkin's very
thinking that,
passionate,
but I didn't know. I didn't want to
showing
say
her
it.
hands, and I'm
but
just staring at her awesomely cool, funky, cool nails right now. So mental health tips. Yeah. I think obviously I'm just going to give some generic tips that we know help, evidence-based tips, but really it's not a cookie cutter process, right? It's not a one size fits all. What's really important is to find the coping skills that help you, right? Based on kind of your preferences. That is a big part of what you work on with a therapist, right? Is kind of individualizing that, figuring out what's meaningful to you. And I always tackle things I think about when we think about stress and difficult emotions, depression, anxiety. We often think about it as a triangle where, you have your thoughts impact your mood and your behaviors impact your mood, right? Behaviors can be things you're doing that aren't so helpful to you or healthy, or things you're not doing that you should, kind of things you're avoiding, right? Or not engaging in. And same thing with your thoughts. It's typically, hey, what kind of things are you telling yourself that are not helpful about yourself, about other people, about the world, about the future? And how do we get those thoughts more realistic and more positive in a realistic way? And so I think kind of summarizing that and giving some tips, on the behavioral side, anything you can do to increase your pleasant events is going to help you with stress management and keep you resilient. And sometimes when we're stressed, we feel like we don't have time for ourselves and we don't have moments for pleasure. But the more you do, and those small moments add up, it can be just making that cup of tea, doing some stretching, taking a little walk, texting a friend that you miss them. Those things and really finding those opportunities, they buffer you against stress. They buffer you against depression and anxiety. So, I just encourage everyone, make a list today. What are things that you like to do that you enjoy, that bring you peace? And it could be bigger things. It could be going out to dinner with friends. It could be playing a sport. But again, even those small moments, taking a bath, are meaningful, and try to do at least one of those every day. So that's really important, again, because that's kind of the behavioral piece, making sure you engage in pleasant events and you don't avoid things, right? And you're giving yourself that time. If you can do things outside, it's even better, because we know that sunlight, obviously we have to be careful with how much sun and wear your sunblock, but sunlight in and of itself increases our serotonin. Serotonin's a feel-good hormone. It's actually related to mood and mood regulation. So if you can do that walk outside, take a phone call sitting outside, you're just going to give yourself an added boost. So get outside, change of scenery. I think during the pandemic, we all kind of stayed inside. We worked inside. It's we never left the house. So get outside as well. And then I think, from the thought side of it is really, it would take a long time to really go through how we tackle those negative things we say ourselves. So an easier tip is to focus on how we increase positive thinking, right? But it's important to do both. It's important to monitor the negative things we say, and it's important to train our brain. And you literally, we are creatures of habit. So if we're thinking a lot of negative thoughts, stressful thoughts, we're literally reinforcing that pathway in our brain. But you can force the opposite. You can train your brain to think more positive, and then that becomes a habit. And so 2 ways to do that are positive, self-statement, self-affirmations. Some people call them mantras, and then practicing gratitude. So when you do a positive self-statement, you got to believe it, right? But things like, I'm proud of myself, or I'm doing the best, or, I deserve, to achieve my goals, or whatever the case is, say that, wake up. You can be your own champion. You have to believe it. But the more you say it might sound a little bit kind of difficult to do and silly at first. But then if you practice it, you really, can encourage yourself to start thinking more positively. And then finally, there is a ton of research on practicing gratitude. So gratitude is, being aware and being thankful for the good things in your life, right? And I think on any given day, good things happen and bad things happen. There could be different levels of good and bad. I stubbed my toe is a bad thing, right? Or something maybe more extreme. And research has shown that people who just focus on the negative things are more likely to be depressed, are more likely to be anxious, right? Are more just not going to achieve that feeling of happiness and good mental health in a way, and mental well-being. And then the opposite, people who tend to recall and focus on the positives, that half glass full person, they have a buffer. They're less likely to be depressed or anxious. They're more resilient when stressful things happen. And so what we can do is literally practice gratitude. And so you can practice gratitude by having a gratitude journal, literally every day, writing the things that you're grateful for. What I do, and I do this with my kids, I have a 5 and a 3-year-old, because I want to start training their brain, right? And kind of building those neural pathways right now so they can be resilient. As every night, part of our bedtime routine is we all go around and say 3 things we're grateful for that day. Right, and we tell each other, and it can be small things. I liked the lunch at school, whatever it was, or big things. My 5-year-old likes to say, I love my family, because she knows it melts my heart and she likes my reaction, but it can be small things too. And that's really important. Or, other ways, saying thank you to people, writing a thank you card, like telling other people, which is like, again, an added benefit of making someone else feel good, those social interactions. It's also practicing gratitude. So that I'm a big believer in practicing gratitude. It is something that literally changes the brain. I do it every night myself.
I was just going to say, Dr. Borzal, just to, put a bee in the bonnet here, add to it. I think there was a study that just came out, or I don't know if it just came out, but came out in the last couple of years, thinking about gratitude and thanking someone. They found in the study, they looked at, they took a group of individuals suffering from moderate to severe depression, and they had that group compared to a group that, didn't write this thank you letter, which I'm about to describe, wrote a thank you letter to someone that they just appreciated, just to demonstrate gratitude, and had a follow up with them. And they found just that alone had reduced their symptoms related to depression tenfold. At least even for the next 6 weeks of their lives. So I don't want people to, when they hear this, to underestimate, like, oh, that sounds like Captain Obvious. Of course, I'm grateful. Not underestimate the impact of what Dr. Birdsall is sharing with all of us, is that when you do practice gratitude, there is a lot of mental health, benefits for ourselves, not just for the ones that we're actually, sharing the gratitude with. So something just to plug.
The active practice. It's the active. It has to be an active task, right? And that's really what changes the brain.
Right. And finally, like stress, the big thing about stress, some type of stress isn't necessarily bad. We're not necessarily out there promoting, like, if you experience stress, you must, be a nervous wreck. Stress is okay to have. It's just that chronic acute stress that then, unfortunately, what it slowly does is it degrades our ability to take care of ourselves, and we start to neglect ourselves. And we lose, when we are neglecting ourselves, we lose habits where those habits help us take care of ourselves. So again, just emphasizing what Dr. Birdsall saying, like, the daily piece is so much better. If you could visualize it, just think that you're just trying to keep your temperature at homeostasis, 98.5, and doing one thing positive, one healthy habit a day helps it maintain that homeostasis.
First of all, so many amazing takeaways. I want to thank both of you. I want to point people to cheservices.com, check out more episodes of the podcast, and thank you for sharing your knowledge and helping us live a less stressful life.
Thank you. Thank you.
Thanks for joining us in this episode of Ready to Talk, Ready to Listen, all things mental health. Click to subscribe to our podcast on iTunes or Google Play. Until next time.